namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. This is Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And just a reminder to go to hotzepodcast.com, that's HOTZE podcast.com, to download all of our podcast programs. Now, this topic is near and dear to my heart because I suffered from it for years, and I know that millions of people suffer from it as well. And I really feel for you if you have got this problem. What am I talking about? Migraines. And people, if you have not suffered from migraines before, maybe you know people who have, and it really is a very debilitating condition that does affect your personal life and your career. So Dr. Hotze, maybe you could explain to our viewers more about migraines.
Okay. Migraine is a form of headache. The headache is just a symptom, really, of underlying problem. So a migraine headache is a form of a headache, a form of a symptom, and it's really caused by severe, oftentimes debilitating pain, usually one-sided. It can cause nausea, vomiting. It can cause tremendous sensitivity to sound or to lights. So a person oftentimes has to seclude themselves in a very quiet place in their bedroom or someplace where they don't hear any noise or have any lights to get as much relief as they possibly can. And these the headaches can last for several hours to several days, and they're, as we mentioned, very debilitating, can oftentimes cause people to miss work or, just not be able to function at all in their household activities or in their work activities. So the real question is, what causes these problems? Most people, when they have a headache, if they go see the physician, he's going to tell them that, your diagnosis is headache, maybe migraine headache, depending upon the severity of it. And he's going to prescribe medication, a pharmaceutical drug, simply to try to mask the symptoms. Remember, when a doctor tells you you have headaches or migraine headaches or cluster headaches or neurological headaches, he's simply taking the symptom and converting the symptom to a diagnosis, which is not. Headaches have underlying causes. They're not caused by low levels of pharmaceutical drugs. Migraine headaches are not caused by low levels of Imitrex or Zomig or other pharmaceutical drugs to relieve headaches. As a matter of fact, all those drugs do is mask the symptoms. Nobody has migraine headaches. Nobody has cluster headaches or any form of headaches because they have low levels of pharmaceutical drugs in the body. There's an underlying cause, and that underlying cause is the diagnosis. So there are really 6 major causes of severe headaches, which oftentimes are referred to as migraine headaches. First is hormonal imbalance that occurs in women during their menstrual cycle. And if a headache, particularly migraine headache or severe headache, tends to occur in a cyclical fashion every month at the same time every month, that will be related to your menstrual cycle, which is related to the hormonal balance in your system over the month of your cycle. So if it happens at the same time every month, it's very classic. That's very classical for headaches caused by hormonal imbalance. They can also be caused by low thyroid, a hypothyroid situation where a person does not have enough active thyroid within the cells of their body, can't produce enough energy, and that can lead to some swelling, some mucin formation, and that can affect the brain. As the brain swells, you can get severe headaches, and that can be a cause of migraine headaches, low thyroid situation. Another common cause of migraine headaches is magnesium deficiency. Magnesium is a natural mineral which the body needs for healthy cellular process and biochemical process in the cells. It's what enables the cells to properly develop the energy molecules in the cells that allow the cells to carry out their biochemical processes. It's also important in relaxing the smooth muscles in the arteries and regulating the heart rhythm. Low magnesium can be a cause of migraine headaches because when a person has low magnesium, they can get spasm of their arteries, and this can occur in the brain, and when it does, it can cause headaches, severe headaches, which are oftentimes referred to as migraine headaches. And I know in your case, when you were having the headaches, we talked about whether or not they could have been hormonal and didn't seem to be because they could occur at any time during the month. And I said, why don't you just try some magnesium? And
that's right. And that did the trick. And I really think looking back that for me, it was actually a combination of hormones and magnesium, because I did notice definitely like on day 2 of my cycle, that would historically be kind of that day when I could kind of count on a migraine, but I would also have them during the month.
Right.
And a lot of small, like more minor headaches throughout. So definitely the progesterone and the magnesium was what did it for me.
That's right, because when a woman has progesterone deficiency and estrogen dominance, that can cause some fluid retention in the brain as well, and that can lead to migraine headaches. So that's common. But also, estrogen dominance also can lead to a magnesium deficiency. So it's important. Most people are low in magnesium. The average person doesn't even get what the recommended daily allowance is, which is low anyway. So I'd highly recommend, in our guess, we recommend 600 to 1,000 milligrams at least daily of magnesium in divided doses. Another problem can be food sensitivities or food allergies. So it's not at all uncommon for individuals to be allergic to a specific or several foods that can precipitate headaches. Some people get it after drinking wine. It's maybe the chemicals in the wine, it's the nitrates. But other people may get it after eating wheat, corn, egg, milk, yeast, soybean. Those are the big 6. Those are commonly in all the processed foods. So any of one of those can cause an allergic reaction, which causes the release of histamine into the system, which can cause brain. It can cause spasm of the arteries in the brain. It can lead to the headaches. It just causes it's a neurotoxin, really. The histamine is, and it can cause headaches by adversely affecting the neurotransmitters in the brain. So that's a very common problem. Another problem we see is with yeast overgrowth. People that have yeast problems can commonly have recurrent and chronic headaches. Now, yeast is caused when a person takes antibiotics because they've had an infection, and those antibiotics have killed not only healthy bacteria, abnormal bacteria, but also healthy bacteria in the gut, and they get a yeast overgrowth, and yeast produces toxins, which can lead to some severe and debilitating headaches. Also, stress can cause migraine headaches. And stress, when people are under stress, their adrenal glands tend to produce high levels of adrenaline. They get an adrenaline rush when they're under stress, get very anxious, and that can cause vasospasm, spasm of the arteries, and that can lead to migraine headaches. So the key thing is not to treat your symptoms, which is the migraine headache, but to treat the underlying cause. Talk with your physician, particularly somebody here at the Hotze Health and Wellness Center who understands this. Talk with one of our doctors here to try to determine whether or not your headaches are caused by hormonal imbalance, thyroid imbalance or decline, magnesium deficiency, chemical sensitivities, sensitivity due to foods, food allergy, or maybe stress. These are some of the common causes of migraine headaches that can be easily addressed without having to place you on pharmaceutical drugs. So my encouragement to you is to get yourself a health coach. This is a doctor and a staff of professionals who can coach you on a path to health and wellness naturally, help you with your underlying problems, solve it by correcting the underlying cause of your symptoms so you enjoy a better quality of life and you don't have to use a bunch of pharmaceutical drugs.
That's right. And you never know how many days you have in front of you. Why not live to the fullest to have a high, really good quality of life? So give us a call today at 281-698-8698. It would be a privilege to serve you. And you don't have to suffer. You don't have to live like this. There is a natural solution. 281-698-8698. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.